Good morning, everyone. Please share your queries. Good morning, Kavita. Please share your queries. Good morning, Parveen Pamar. Good morning. Please ask if any queries. This is question number 2, right? Let's see what is question number 2. Sure, Praveen, I will send you all the chanting ones, okay? So, Dr. Kavita, in the second question, it was that, so whenever these clinical types of abortion, they come to you, you just have to do one thing. You have to see what is the fundal height. Okay, you have to see what is the fundal height. If the fundal height is equal to or more than the period of gestation, it means it is growth of it is normal. Okay, in the case of abortion, what you have to do is you have to see what is the fundal height. Once you will see the fundal height, it can be possible that fundal height is equal to period of gestation, or the fundal height is less than period of gestation. Okay, and if it is equal to or more than period of gestation, then you have to see what is the os. If os is closed or os is open. If os is closed, what is the diagnosis? Yes, if os is open, what is the diagnosis? And if os is closed, if os is closed, then the diagnosis is threatened abortion. Okay, and if the os is open, then the diagnosis is, if os is open, then the diagnosis is inevitable. Okay, inevitable, because nothing has come out. Now, if the fundal height is less than period of gestation and os is closed, okay, it means everything has come out, then it is a complete abortion. Okay, and if os is open, it means something is left, then it is incomplete abortion. Okay, is it clear, Dr. Kavita? Is it clear? Let's take your next query. Next query is number 5. Number 5 is what is the diagnosis here? Dr. Kavita, if you can do it with the help of this, then do it. 19 years, primary gravida is 10 weeks pregnant and complains of bleeding per vagina and pain in abdomen from 2 days. So it is the lady is 10 weeks pregnant and the fundal height is 6 weeks. So now already we tell you have to see fundal height. Okay, if the fundal height is equal to or more than period of gestation, or it is less. So since here the fundal height is less than period of gestation, so we have to see os ka condition. Os is open or closed. Os open or os closed. If fundal height is less, it means something has come out. Okay, now something has come out, either it is completely or not, that will be happened by os. If os is closed, means everything has come out, so it is complete. And if os is open, then something is left out, it is incomplete. Is it clear? Is it clear? Next is question is 7. Next question is question number 7. Question is saying that on ultrasound and bimanual examination nothing was left. Ultrasound and abdominal examination and it doesn't let. Here we see the condition in which the beta HCG, okay, right? We have to see what is the condition. The condition in which the beta HCG is positive and we are not getting any relevant information about the ectopic. Okay, any relevant information on bimanual or ultrasound. Okay, so here the question is 22 years is overdue by 2 weeks. Okay, it means the lady is having overdue 2 weeks. She visits the OPD with complaints of vaginal bleeding and abdominal pain. Now here the lady is coming with vaginal bleeding and abdominal pain. So what are the diagnoses if the patient is coming with bleeding in early pregnancy? So it can be molar, it can be ectopic, it can be abortion. Out of this it is there. Okay, out of this we have to choose one thing. Now rest we will find on examination. Okay, vitals are stable, abdominal examination is okay, and then bimanual examination reveals a bulky soft uterus and no adnexal mass. So no adnexal mass, it means it is either molar or abortion, right? It is either because there is no adnexal mass, so ectopic is ruled out here. Okay, so either it is abortion or it is molar pregnancy. So here we can say that to see whether the pregnancy is progressing or not, we will do the beta HCG after 48 hours, because if beta HCG is doubling in 48 hours, this is only found in intrauterine pregnancy. If beta HCG is increasing and doubling in 48 hours, okay, and if beta HCG is decreasing, then it is a failed pregnancy. Okay, so here beta HCG done at a gap of 48 hours will tell us. Okay, is there any problem, any other problem? Now next is question number 10. Okay, question number 10 is here they have asked us, third para is admitted with a sudden history of sudden onset of abdominal pain and bleeding. Again, abdominal pain and bleedings are have 3 diagnoses. Abdominal pain and bleeding, they have 3 diagnoses. We have to choose one out of the 3. Either it is abortion, either it is ectopic or molar. Okay, now here they have asked we have to choose one of what is the most appropriate management. Perform laparoscopic salpingectomy, perform laparoscopic salpingo-oophorectomy. So next thing which they have given in the question is its blood pressure is very less. It is 80/50. It means that her vitals are not stable. Patient is going into hypotensive shock. Patient is going into hypotensive shock. Patient is going into hypotensive shock. Okay, now in all abortion, ectopic and molar, there is only one condition in which the patient goes into hypotensive shock, that is ruptured ectopic. Neither in the molar pregnancy patient goes into the shock, neither in the abortion patient goes into shock. Only the patient goes into shock only in one condition, that is ruptured ectopic, not unruptured. In ruptured ectopic there is lot of collection of blood there. Okay, that is supported by the fact they are saying transvaginal ultrasound scan reveals the presence of large amount of free fluid. Okay, free fluid in the pelvis means there is intraperitoneal hemorrhage. So when it is a ruptured, now what is the treatment of ruptured ectopic? The treatment of ruptured ectopic is, yes, salpingectomy. It is never salpingostomy. It is salpingectomy. Okay. Now when the vitals are unstable, then we have to do, when the vitals are unstable, then we have to do laparotomy. And when the vitals are stable, then we have to do laparoscopic procedure. Okay, laparoscopic procedure. Is it okay? So that is why we choose perform salpingectomy through laparotomy. Okay. Next question is your question number 10. 10 we have done. Question number 12 and 15. 12 question is, now see here, APLA. What are the cause of recurrent pregnancy loss? First most common cause is cervical incompetence. Cervical incompetence. Okay, cervical incompetence is the most common cause. Next is anatomic abnormalities of uterus. And third most common cause is APLA. APLA, what happens in here, in APLA, antiphospholipid antibody syndrome, what happens that antibodies are formed which leads to deposition, formation of clot in the spiral arteries which are supplying the placenta. So what are the clinical finding in a patient with APLA? Recurrent pregnancy loss. If the pregnancy progresses, then there is preeclampsia or hypertension. There is preeclampsia or hypertension, or you can say eclampsia. Okay, then there can be abruption. Okay, so they have told you that in the one history, the patient was saying that it was a history of early onset preeclampsia. Okay, so this itself says that it is a case of APLA. Okay, when abortion is accompanied by preeclampsia, then it is a APLA syndrome. Okay, now here you see first abortion was at 10 weeks, second abortion was at 8 weeks, and the third abortion was at 24 weeks. So all these are telling that it is not a case of cervical incompetence. Okay, it is not a case of cervical incompetence, because in cervical incompetence what the history is given is that the history which is given is painless sudden expulsion of the fetus. Okay, painless sudden expulsion of the fetus, right? So this is it. Now what is the treatment of it? Before conceiving we have to start aspirin, and after conceiving we have to give low molecular weight heparin. Once the fetal heart rate has come and the pregnancy is confirmed, then we have to give the low molecular weight heparin. Your last question is number 15 question. A 30 years old woman underwent a suction evacuation for HMOL, which was confirmed by histology. After 8 weeks, if beta HCG is positive, after 8 weeks, if beta HCG is positive, it means that it has not gone zero or it is not decreasing. 2000 international unit after 8 weeks is very high. It means this is a confirmed case of choriocarcinoma. Choriocarcinoma. So what is the treatment of choriocarcinoma? Methotrexate. Is it okay? Any more query, please ask. So here the answer is commence the treatment with. So here the answer is methotrexate. Okay. Okay. So Anything else? Thank you, Kavita. Thank you. I hope you understand this topics, the questions. Thank you very much. Thank you for joining.